Ever wonder if anesthesia is right for you during your colonoscopy or gastroscopy, also called an upper endoscopy or EGD? This video will help you understand the risks, benefits, and alternatives of anesthesia for such procedures. An upper endoscopy is when a doctor specializing in digestion, called a gastroenterologist, inserts a long camera into your mouth. He or she will advance it all the way through your stomach, checking for signs of cancer, indigestion, or other disease. A colonoscopy is the same idea from the other end. In the United States, most patients getting a colonoscopy or upper endoscopy receive intravenous sedation. The most common anesthetic used is a medicine called propofol, although there are other options. If you agree, your doctor or nurse will place a small tube into your vein with a needle called an IV. Medicine can then be given in varied doses to help you sleep through your procedure. Additional doses can be given if your procedure is longer than expected. The vast majority of patients receiving IV sedation like this are glad that they did. Your expectation can be to fall asleep before the procedure starts and wake up after. Like all medical interventions, sedation anesthesia has some risk. About 1 in 10 receiving it will experience some nausea and may even vomit afterward. Anesthesia will impair you from driving for several hours, so you should arrive with another adult to help you get home. Some memory of part or even all the procedure are still possible. Anesthesia is given by a separate practitioner from the doctor doing your procedure, because all anesthesia could affect your breathing. Usually, your anesthesia provider can keep you safe by suctioning out your mouth or breathing for you with a mask. Rarely, if those are not effective, placement of a breathing tube, also called intubation, like that used for general anesthesia, may be necessary. That's why, although rare, any type of anesthesia carries a very small but real risk of death or brain damage. This risk could be higher if you are obese, smoke, or have other diseases that affect your breathing. It is possible to do a colonoscopy without anesthesia, but it is difficult to predict who can tolerate the procedure that way. Skipping anesthesia for an upper endoscopy is less feasible because of the constant nausea and gagging one would experience. Also, your gastroenterologist may not wish to try if a completed procedure is not likely. In the event you choose not to have sedation anesthesia in the endoscopy room, you may not want to have the procedure at all. In that case, ask your gastroenterologist if other methods of colon cancer detection would be right for you. This video is no substitute for individual medical advice. Now you have some basis to ask your anesthesia provider helpful questions while you plan your experience together.
This video is brought to you by Anescribe.